So seronegative spondyloarthropathies are called seronegative because they're rheumatoid factor negative. They're also HLA-B27 linked, so the HLA gene is associated on the MHC1, and the concordance is about 60-70%. So if someone has psoriatic arthritis, for example, it's about a 60 to 70% chance that they'll have an HLA-B27 gene as well. There's a degree of overlap in the conditions, and spondyloarthropathy basically means there's inflammation along the vertebral column. So first one is psoriatic arthritis, and you get an asymmetrical joint pain and swelling, usually affecting the fingers. You can also get dactylitis with it, which is a common thing, and the fingers and toes, and basically they swell up in sausage-like shape, so it's a fusiform swelling. You get psoriatic skin changes in roughly 30% of sufferers, and psoriatic skin is this scaly pink condition of the skin, which affects mainly the flexures, so in the elbows and also behind the knees. Also, you can find it behind the ears, and usually you'll also find it in the umbilicus if you look hard enough. X-rays of the hands affected will show pencil and cup deformities, which is when the proximal joint surface erodes away and it sort of becomes a cup shape. And the treatment is non-steroidal anti-inflammatories and pain relief, physiotherapy, and then disease-modifying agents such as methotrexate, and if uncontrolled, TNF-alpha inhibitors. Ankylosing spondylitis affects young men with a ratio of 8:1, so 8 men for every 1 female affected, and you get it usually in the spine and sacroiliac. So the first joint is usually the sacroiliac joint, which is felt in the lower back, and you can take X-rays, but it's very common not to really spot it on X-rays, and that's why the clinical guidelines would suggest that you get an MRI instead. With ankylosing spondylitis, the history will be worsening, stiffening, and back pain, and then they lose this lumbar lordosis and have a very straight, upright, bamboo-like spine. So on X-rays, you might get bambooing of the spine, which is when the vertebral bodies lose their normal round shape, and they look like segments of bamboo instead. With ankylosing spondylitis, you also get some extra-articular manifestations, and remember it by the 5 A's. So you can get anterior uveitis, apical lung fibrosis, aortic valve incompetence, amyloidosis, and autoimmune bowel disease. And I think you can also get some problems with your Achilles tendon, so you can get an Achilles tendon pain and rupture. So enthesis is basically when the tendon inserts to the bone, you can get inflammation there. And you get that in most of the types of seronegative arthritis. So early treatment, and new guidelines are early DMARDs as well, so disease modifying to stop joint destruction happening early. And they might also need surgery, such as total hip replacements and knee operations to realign, and that's been shown to help as well. Inflammatory bowel conditions, ulcerative colitis and Crohn's disease, we've seen those in the gastroenterology lectures. And the mainstay of treatment is steroids in acute flare-ups and disease-modifying drugs and surgery. In particular, in UC it's curative, whereas Crohn's you do limited resections because it can affect mouth to anus, as you'll remember from previous lectures. Reactive arthritis used to be called writer's arthritis, but it's been officially renamed due to him doing some bad things. So reactive arthritis is classically explained as, can't see, can't pee, can't bend the knee, and that's a uveitis, a dysuria, and an arthritis, usually monoarthropathy, so affecting one large joint such as the knee or the hip, and it is linked to chlamydia and gonorrhea, which are obviously STIs, sexually transmitted infections, but also don't be caught out, it's also more commonly found in things like Salmonella, Shigella, and Campylobacter. So the mainstay of treatment is to treat the underlying cause with antibiotics as appropriate and non-steroidal anti-inflammatories, and hope that the pain in the knee will start to settle as you treat the underlying causative agent.